Well, first, let me just say I remember very clearly the days of back alley abortions. When I was a 16-year-old, I got pregnant, and the options were very, very few.
5,000 plus deaths, not infection and hemorrhage, except deaths to women every year in the 60s because of botched abortions. The hospitals had wards devoted to botched abortions.
We all have friends who faced horrible circumstances, who can remember times when they had no alternative, who even went to backroom alleys in order to get an abortion.
There are always men making decisions about women's bodies.
No reproductive health care whatsoever, no abortion care. You couldn't get birth control unless you were married, and there was no sex education, there was nothing.
This is not something that we want to go back to.
When the bill was first introduced in 1963, no one talked about abortion. And that was true in 1965 and 66, when Assemblyman Tony Bielenson took up the cause.
I introduced the bill, and at that time, abortion was not a public issue.
Of course we do have abortions, we don't talk about them. Of course we use birth control, we don't talk about it.
In fact, in those days, the Los Angeles Times, which 2 years later started supporting my bills, never printed the word abortion. They always used some euphemism, such as illegal surgical procedure. It failed in committee the first time in 1963, and that was expected, and it didn't upset me because I knew we didn't have the votes to get it through.
I was working with the OBGYNs and the pediatricians and the family physicians. They were a big part, those three groups, of wanting to make changes in the abortion laws in California. And that was for a very simple reason. Women died because of illegal abortions, or they got severe infections and could never have children again. It was a marketplace that didn't care about the patient.
In 1963, 64, and 1965, there was a very serious epidemic of German measles or rubella in the United States. If you were exposed to that early in pregnancy, then the chances were very good that there would be a stillbirth, a miscarriage, or very, very serious birth defects. So compassionate doctors began to end those pregnancies. But in California, it was kind of a gray area under our old criminal abortion law. That law said only the life of the woman would justify an abortion. So when very distinguished obstetricians began to do rubella abortions, an anti-choice member of the then California Medical Board moved to yank the licenses of 9 San Francisco doctors. And that galvanized public opinion, at least among the medical community, because it really highlighted how archaic the old criminal abortion law had become.
1967, what had changed was, we've had grassroots support for the bill that included religious leaders, medical leaders, Association of University Women, California State PTA. People were talking about it, and that contributed to the overall success. The only opposition really was the Catholic Church, but by then the momentum had shifted.
In 1967, of course, California led the way.
I reintroduced the bill. The newly elected governor of California was Ronald Reagan, most conservative person, of course. As he raised his pen to sign the bill, put it down for a moment and said, "Well, I've changed my mind." And then he smiled and he said, "Okay," and he signed the bill.
California law was essential not only for making abortion legal in California, it also, I think, galvanized support when Roe v. Wade went to the Supreme Court.
We knew that Roe v. Wade was the beginning, not the end.
So the fight is different now. The fight now is access.
The biggest fight here in California, and this isn't unique to California, is about affordability. So there's some economic issues, but I think also culturally we still have this baggage of women not being able to make their own choices about their own bodies.
We still do not have access to the health care that we need. We do not have access to cultural, age-appropriate, gender-appropriate health care. How do we make sure that all women get on this train and not just a particular group of women?
AB 154, the bill that passed this year in California, will allow physician's assistants, registered nurse midwives, nurse practitioners to be able to train to provide early abortion services.
And that was important to expand access to rural parts of the state and to urban areas that had been underserved.
I authored AB 154 because having worked at a clinic that provided abortion services more than 20 years ago, I knew how important real access was.
There are a lot of factors that go into the decision to have a child or to not have a child and how to raise a child. And the reproductive rights movement was not looking at all of those factors.
Reproductive justice means much more than an abortion.
The morning after pill, emergency contraception, California played a huge role.
We demonstrated through a study that it can be safely dispensed by a pharmacist. There was no reason for a woman to have to go to a medical provider first. It's safe enough to be over the counter. As we know today, the FDA has ruled that.
It was thanks to the data that was collected in California that we were able to get an FDA approval for the nation.
I mean, we, of course, focused on birth control and abortion, but we were also very adamantly against sterilization abuse.
Here in California, I believe we had the most sterilizations in the nation during the formal and legalized eugenics programs that sterilized women.
Eugenics, the idea of eugenics is to clean up humanity or to clean out the gene pool and create a better race. It was spearheaded by very prominent public figures, people that had that were wealthy bankers, people that were noted in science and had won Nobel Peace Prizes.
It was targeting specific groups of people based on their race, based on their income, based on what their immigration status, based on whether they had a disability.
In the 70s, there was exposés by women's groups and some residents that were working in teaching hospitals, mainly in LA and Chicago, that exposed the atrocities that were going on in those hospitals, where women that during the middle of their laboring or having a C-section were encouraged, really forced to have a tubal ligation. And then we got what we have today, which is federal requirements that women not be coerced into getting a tubal ligation under very bad circumstances.
In terms of the California prison situation right now, we're finding that it's not necessarily foolproof. The people that were, conducting the sterilizations were somehow able to move around those regulations.
This ended in 2010, right? So this is not something that we think about that happened years ago. This is something that we still have to deal with, and people making judgments about who should be having children and who should not.
California is very important, not just for the women of California, but for the women across the country.
I'm very interested in unleashing the power of women to a fuller extent. Of course, empowering women means giving them their reproductive health.
Without reproductive freedom, you don't get employment or educational opportunity.
So we must be vigilant because there are forces here in Washington, D.C. who want to take us back to those days, the days of back alley abortions.
When women are able to fully access and have full control over their bodies is victory.